Good day, residents of Warren County. With increased testing, we now have 7 confirmed cases of the COVID-19 disease in our community. Many surrounding counties have more cases, and the state rate has increased over 2,000 in a little over a week, with Sunday's numbers jumping over 400. With that considered, we are not ready to do business as usual. Even with Governor Lee's new recommendations announced this last week, it's good personal policy to play it safe and take measures to protect yourself and your family and the safety and welfare of those that you love. I'm urging everyone to be tested and to have our National Guard at the local health department who will be there from 9 a.m. to 3 p.m. each day, Monday through Friday, to assist in that effort. On March 16th, in an effort to mitigate and contain this pandemic that is facing our community, in accordance with TCA 58-104, I've issued a local declaration of emergency, which will be renewed each week until this crisis ends. My preparedness team has worked diligently to communicate information to the public, the safety and security of all of our residents, but particularly our first line of defense, our first responders, our health personnel, hospital workers, and essential workers is critical to our success as a community. We have to adapt to the ever-changing challenges and adjust accordingly. I commend the efforts of all of those heroes and honor their service today for what they have done to bring some stability to our lives during this crisis. My economic recovery team has worked diligently with Washington and Nashville to develop policies and to coordinate with the governor with his executive orders for the reopening of business. We want to thank all of our business leaders who provided local input to Governor Lee that was used in the Tennessee Pledge as an initiative to jumpstart our economy again. There's nothing perfect in this policy, however, and day to day we receive updates from the governor and his news conferences in order to give us better direction. As county executive, I urge all residents and businesses to take every measure to protect themselves and their employees. The use of social distancing, mask, and personal hygiene measures, as outlined by the CDC and our public health department, will enable Warren County to restore and rebound the vitality of our community. But the crisis is not over. Through cooperation and practicing caution, we'll remain Warren strong as we combat the challenges that we face each and every day. We must stay united in our efforts and communicate and be a team, but together we can do this. Today we have Mayor Ben Newman from the City of McMinnville, Dr. John Berline from St. Thomas, Pat Williams from the Public Health Department, Carrie Baker from the Upper Cumberland Human Resource Agency, and Sarah Cantrell from the McMinnville-Warren County Chamber of Commerce.
Thank you, Executive Haley. I'm Ben Newman, Mayor of McMinnville, Tennessee. Thank you, Ben Lohman, for allowing us to do this on a weekly basis. We really appreciate it. And thank you for everyone else who came today to come and speak about the ongoing pandemic and the things that each of you can do to help us. As of April 27th, as Mayor Haley said, we have 7 confirmed cases in Warren County, Tennessee. That's up a little bit from where we were just a few days ago. That shows that a couple of things. Some of the things that we're doing is working. The staying at home, social distancing is really helping to keep that number low, lower than a lot of our contemporaries and lower than some of our surrounding counties. That doesn't necessarily mean that this is over, though. It's still important to utilize social distancing, utilize good hygiene, wash your hands when you can. Just be careful, watch what you're touching, watch what other people are touching, and make sure that you don't cross-contaminate things as you move forward in your day. Governor Lee announced that our state is reopening, is in the process of reopening. That doesn't mean that everything just automatically goes back to normal, as Executive Haley said. Restaurants are open at 50% capacity, but must follow the safe precautions and protections in place. There are a lot of restaurants in our area that haven't opened yet and are deciding not to open because they think that's the right thing to do, and I congratulate them for doing that. Retail is the same way. They must be open at 50% capacity and follow safe practices. Salons, gyms, entertainment venues, and things of the like are to remain closed until further orders of the governor. Please take this seriously. We still have to get through this and get to the other side. The city board will meet tonight to discuss what it will do with our parks and our employees and other public spaces that we control directly. We haven't made any decisions yet, but those decisions will be made tonight. My thoughts on it are that playgrounds will likely remain closed, that we will consider reopening tennis courts, the skate park, and outside bathrooms. The city and other organizations are trying to prepare for the reopening. Your local utilities are trying to prepare for the reopening. Please keep in mind that your utilities, gas, water, electric, the bills still have to be paid. Some of you are experiencing financial difficulties, and that's understandable. These utilities, however, cannot forgive your bills. There are many utilities who have put a moratorium on their cutoff policy, but that's not a forgiveness of your bill. These bills are still owed, and they are still due. Please take that seriously. Though you may be experiencing some financial difficulty, there may be places that can help you pay some of these bills, but they will not be forgiven by the utilities themselves. If you find yourself in a situation that you're unable to pay, you haven't been cut off yet, make arrangements to make payments. Pay as much as you can on your bills. Pay as much as you can on your rent as well. Utilities will start cutting off, some possibly in June, some possibly in May, and some may have already started their cutoff policy back. Upper Cumberland Development District, UCHRA, is here to help you. There will be some information given to you shortly on some of that help and how to contact them. The courts are closed right now as far as conducting evictions. However, the courts will open back up and the eviction process will begin. So keep that in mind. Though you may not be able to be evicted right this moment or next week, soon the courts will reopen and evictions will start back. Like I said, try to make arrangements with your landlord to get as much paid as you can. If you're a landlord, try to come to some type of agreement with your tenant. Be understanding of what they've been through. I understand that everyone has bills to pay, even landlords do too, so tenants keep that in mind as well. Now, with the reopening of the state, your city leaders are trying to do what we can to get information together, to gather that information together, and try to find a way to get that information to you. As this moves on, we're watching a lot of conferences through the internet, through our state agencies, through our state government, and trying to gather that information so that we can make good decisions on what we have to deal with, and so that we can possibly and hopefully get that information to you. A lot of what we're doing here today is trying to get that information to you as well. So thank you for tuning in. Thank you for listening. Thank you for doing your part to stay away from each other as best you can and follow the precautions that are in place. So keep that going. We are the volunteer state, and I think that each of you, whether you're a business owner, a worker, or otherwise, do your part and encourage others to do the same thing. Thank you.
Good morning. I'm Dr. John Berline. I'm one of the lead hospitalists for St. Thomas Health and work at St. Thomas River Park and across our region. A couple of points I wanted to bring forward as others have, and we will continue to reiterate. The governor's plans and the city and county's plans are really based on our attempts to open and become as normal as possible. However, social distancing, hand hygiene, routine care, masking, and other preventive structures or preventive mechanisms still need to be in place as we move forward and begin to open our doors. From the hospital perspective, I can say that our volumes, clearly our EDs, our other areas are safe. We have provided a number of new venues such as telehealth strategies and a number of our practices are seeing even as much as 40% of their regular volume via telehealth. From the standpoint of entry and visitors, we are still planning and will continue our restrictions around visitation for patients at the hospital. I know this is a challenge. We have put in place a number of opportunities to use other telehealth, so FaceTime. We can use other modalities in a number of the rooms, a number of isolation areas, so that the patient and family can actually still remain a unit and communicate effectively about the patient's care. Physicians are also providing some additional telehealth services within the hospital, so be aware that you may see some of that if you're a patient within the hospital. From the community perspective, we are all, as we say, as part of the volunteer state. We have seen a number of patients in our community and at St. Thomas River Park that we're sharing with Murfreesboro and the Rutherford market. We have seen a number of nursing home facilities across all of our regional hospitals, patients from those facilities. And St. Thomas remains strong and has provided support for the Gallatin Nursing Home, for example. With our DeKalb facility, we provided care for patients there. We have continued to provide care for patients from the Boulevard Nursing Home at Rutherford in our contained COVID unit. So we have a separate unit within the facilities in which we provide those services to patients who are known to be COVID positive or suspected of being COVID positive until their evaluation is complete. I will say for our emergency cases, obviously surgical cases and emergent cases have continued. We are, like the rest of the system, looking at opening up to more elective cases, provided we have a continued decline across a 14-day period in number of cases of COVID-19 or new cases of COVID-19. So we are in the process of developing the plans to provide safe and effective care. It will still include some limitations on visitation, particularly in the surgical areas, but we are planning the week of the 4th to begin some cases, provided we continue to see decline in overall cases. We're beginning the week of the 4th to do some lower acuity cases, things that are generally like cataracts or things that don't require a lot of aggressive care and do not require hospitalization post-operatively. So we will start with those cases. We will phase in additional and more complicated cases over the next several weeks at the hospital. I know a common question we receive is, are we going to be testing everybody? The answer to that currently is no. Ultimately, we may get to that point where all patients are tested. We are not currently there, and we'll get to a point where employees are tested, but currently we are not there. Everyone is screened on entry to the hospital. All employees document absence of fever, absence of cough, and we do that on a regular basis. We do it every time we come into the facility. You'll see my badge has a number of color-coded dots around the badge, and that's an indicator with a date that we have done that screening, and you'll see it by facility. So all of our facilities are even different. So you can see I've been to 3 facilities. So we've been screened 3 separate times. We will continue to screen patients as they enter, employees as they enter, and any family members who bring the patients, we will screen them and ask again, once the patient's being triaged through the emergency department, that visitor allow the patient to be by himself or herself. We have made some exceptions on a case-by-case basis, but generally we have, in order to protect patients in the community, limited access to the hospital in general. So those are my updates from the facility and from the hospital perspective. We continue to have adequate access to PPE, adequate ventilators and other support. We certainly have a number of open beds and capacity from a nursing perspective, from a physician perspective. and equipment perspective, and continue to monitor that on a daily basis to make sure that we're able to provide the services that the community needs and expects. Thank you. Pat?
Good morning. I am Pat Williams, Nursing Supervisor for the Warren County Health Department. COVID-19 testing continues at the Health Department. Since our last meeting, we have tested over 284 patients there at the drive-through clinic. We are providing testing Monday through Friday, 9 a.m. to 3 p.m., and we do encourage everyone to come and be tested, whether you have symptoms or you have no symptoms. We would like for you to be tested. It is a free test. It does not cost anyone anything, and it is a quick process. With it being a drive-through testing center, you remain in your car during the whole time. Someone will walk up to your car and gather your personal information, and then the test is performed while you sit in the car. The results are coming back in about 2 to 3 days currently. Each person tested will receive a call from a nurse at the Warren County Health Department with their results. On May 3rd, Sunday, we will be having a special drive-through clinic at Montlow Community College parking lot from 1 p.m. to 4 p.m. This is located back behind River Park Hospital. Again, it is a free test, and we do encourage everyone to come and get tested that day. Thank you.
Good morning. I'm Carrie Baker with the UCHRA. I wanted to tell you a little bit about our programs that can help everyone right now. First off, our hours right now are 8 to 12. You can also reach me. My email is cbaker@uchra.com. Our phone number is 931-473-6652. When we go home during the day, we're also looking at our emails so that if you need help, we will try to email you back and tell you the things that you could bring in. Some of the services that we provide, first off, is electric. So Mr. Neiman talked about if your bills are late, you can call us, you can email us, and we can tell you the things that you need to fax us, email us, or you can come to the door and we will set the stuff outside the door. Some of the things for electric that you need is your 12-month printout, your most recent bill, Social Security cards for everyone in the home, and your photo ID and proof of income or no income. It could be also your unemployment. We also have vulnerable population and reward to work. These are programs that might help you with your rent. I know a lot of people are going to be behind on their rent, and for those programs you can email or call, and we would also leave those outside the door or let you know what you need. Everyone knows UCHRA for our transportation programs. We have the Go Upper Deviated Route in town. Those are the new buses. We're very proud of those. Monday through Thursday, we're running 7 o'clock to 6 o'clock is when we end. On Friday night, we run from 7 to 10. And on Saturday, we're running 10 to 10. Our numbers are down, but we hope everybody still continues to ride. Our other route is all of our smaller buses. We're going to Murfreesboro and Nashville on our I-24. On Wednesdays, we go to Chattanooga, we go to Manchester, Tullahoma, and Cookeville. So please call and schedule those appointments. We're there to help you. We also help with commodities if you're needing help with food. Usually you come in and fill out that application. Right now you can call over the phone and we can get your information. We also help with the Warren County Food Bank. Our hours have also changed there. They're from 11 to 2 right now, and that's Monday, Wednesday, and Friday. And insure. The elderly are always needing help finding insure at a reasonable price. We have that at our location. If you'll call us ahead, we can come to the door and give you the insure. And that's chocolate, butter pecan, vanilla, strawberry, and there might be another one that I forgot. One other program is weatherization. And if you're needing help with windows, doors, your air conditioning unit went out, there's all kinds of things that we would fill out an application. It doesn't mean you would qualify for all those things, but we would fill out the application and see what you might qualify for. So make sure, again, you call us, you email us, and we'll see what we can do to help. Thank you.
Good morning. I'm Sarah Cantrell, Interim President of the McMinnville-Warren County Chamber of Commerce. Announced on Friday, Governor Bill Lee's Tennessee Pledge allows restaurants to open effective yesterday, Monday, April 27th, but with restrictions, and retail establishments to open tomorrow, Wednesday, April 29th, with restrictions. These restrictions include operating at 50% capacity, face coverings for employees and shoppers, and social distancing between tables or patrons of 6 feet. While restaurant dining rooms may open, bar areas should remain closed at this time. Retailers are also encouraged to develop traffic plans for customers within stores and continue to offer curbside pickup if possible. It is important to note Governor Lee has clarified these are not mandates. While some of our local businesses plan to open within Tennessee Pledge guidelines, others feel it is safer to continue operating under previous and more socially distant guidelines. Essential businesses that have been operating may continue to operate with no additional requirements. Governor Lee will be sharing best practices for all businesses, including those deemed essential, in the coming days. In terms of opening other businesses beyond restaurants and retailers, we have not received a timeline for those other businesses to open or social gatherings to begin. The state will continue to watch COVID-19 cases, and if they do not increase, the openings will continue to be slowly phased in. The McMinnville-Warren County Chamber of Commerce will continue to update you with any changes or additions to Tennessee Pledge as we receive them. For more information, you can visit warrentn.com/COVID-19-info or our Facebook page. You can also check out our Facebook group, Connecting Warren County Amid COVID-19. While we at the Chamber are not business experts, we are business advocates, and we are continuing to work diligently to get the information and tools Warren County needs to navigate this pandemic. We are stronger together, and together with a cohesive plan, we will see this through. Thank you, and God bless you.
As most of you know, much of this has not been easy over the course of the last few weeks. But I want to congratulate all those people who have conformed, done what was right. And to quote the governor, most people do what is right most of the time. The stimulus money is coming into the community, but we urge everyone to be responsible with those funds and to do the right thing in order to pay your bills and do what is responsible for your family. We were one of the first Tennessee counties to receive this additional funding through the CARES dollars that came from Washington. We are continuing our feeding programs across the community, and we have added some other options as well. Wild Bills is now part of that feeding program that was funded through this additional monies. As city and county officials, we have very limited authority over enforcing state and federal directives. Our actions derive from the recommendations of Governor Lee. We cannot relax or enhance those measures outlined in his executive orders. The governor has the final word. My recommendations coordinate with those issued by the governor and emphasize protecting our residents while restoring the local economy. To protect the most valuable populations at the hospital, nursing homes, assisted living facilities, and our jail, we are urging that those buildings continue to restrict public access and to use all the health measures in order to protect those people. For the safety of those people that are at risk in our community, I'm asking most people that are at risk, that have health issues, to remain at home as possible and use every measure suggested by the CDC and public health officials. As we increase our local testing of residents, especially our government employees, healthcare providers, and essential business workers, and those in our food chain, will be able to monitor these results and take better action as a community as we look forward. We still suggest that everyone continue social distancing and adhere to those safety initiatives for personal hygiene. If we cooperate with the directives issued by Washington, but especially those orders by Tennessee Governor Lee, through his daily news conferences at 3 p.m. and after monitoring the health results that are published at 2, our governor will continue to hold his conferences and to issue information to further guide us. Our governor will hold a televised town hall meeting this Thursday at 6:30 p.m. New information will be shared by his command team and economic recovery group. To date, his Tennessee pledge, Governor has outlined many of those measures for reopening that have been detailed by our Chamber President, Sarah Cantrell. The Governor will announce about churches, entertainment venues, and large social gatherings of 10 or more in another executive order that will be done either through this week or through next. In the meantime, the state's going to continue to monitor test results and the changing metrics of this virus to help determine the next steps in relaxing the shutdown and reopening our economy. Dr. Piercy, who's Commissioner of Health, will give updates daily and inform the public of any changes in those numbers as we adapt to this ever-evolving crisis. In the meantime, I will continue to evaluate conditions and adapt as necessary. My team will continue to communicate information that becomes available. I want to thanks to PEG Broadcasting, WCPI, and especially BLTV for being the voice of the people during this crisis. Your message has been strong and clear across the last few weeks. Furthermore, I too have issued no mandates, and neither has the governor, but have followed the recommendations from federal and state officials. Daily conference calls give me updates and important information that I share with each and every one of my residents. I strongly urge adherence to Governor Lee's executive orders. This will be critical to further relaxing of our business reopenings and will allow us to resume some important measures of normalcy as we approach each and every day with new information. Protecting lives and restoring economic vitality is a priority of mine and the governor's. My local recovery team takes a proactive approach and communicates information to business and industry as it becomes available. Our chamber has led this charge. Warren County government will continue to operate and provide essential services, will be adjusted, however, to protect our employees. My website, and it's posted on the doors about our changing hours. Right now, county offices will remain closed to the public until May the 4th. We'll resume our Tuesday, Thursday, 8 a.m. to 12 noon schedule by appointment, and we'll carry that out until further notice. The drive-through window at the county clerk's office will be open starting Monday through Friday, 8 a.m. until closing time at 4:30, starting, that is, May 4th. All public admissions to the courthouse and my administration building will be screened by officers. The drop boxes will still be available at both locations for your convenience. Courthouse proceedings will follow the guidelines that's issued by Supreme Court Justice Bivens. As always, call the appropriate office, listen to the phone messages, and ask for information before you proceed to any county offices. They will direct you with important information that will service your needs as our residents and as taxpayers. I've encouraged all county employees to be tested over the next few weeks before we open for business again. So I was tested just last week, and thankfully I was negative. And so we hope that more and more people test negative as well. But I've urged all my employees to use personal protection equipment on the job and within the offices and as they deal with the public. As county executive, I'm here to serve each and every one of you. Together, we can do this. We must remember that this has not been easy for any of us, from the federal level all the way down to local officials. But in our hour of greatest need, we discover our greatest selves. So thank you for your support and continued confidence in my leadership. We are Tennessee strong. We are Warren strong. Together we can do this. Thank you.